As usual, it is my pleasure to be here. I hope I can share some useful and important information as we see our COVID numbers increasing quite drastically. I will start with our general graph here showing our huge increase that we have beginning at the end of June, June 28th. This started rising very, very quickly. The line that you see here is a complete vertical line. In terms of significance, a vertical line like that is very dangerous to the community and to everyone involved because it doesn't give the community time to adjust for those huge increases that we started seeing. And I will show you that as we go through our numbers. So the rest of the country is seeing a slight little decrease here. The highest number was a few days ago, and then we've had a little bit of a dip in the next couple days. But as you can see, these numbers on this graph have had spikes many times, but however, we expect that this is going to continue to go up the way the numbers look. The number of deaths also decreased just a slight amount in the last 30 days. And we are going to show all those graphs for our particular data here in Palm Beach County. At this point in the United States, we have 72.1% of adults with at least one vaccine, and only 50% that have completed the series. That's when you have protection against the virus. We remain on a high level throughout the country, but we are seeing some counties decrease a little bit on some parts of the map. So there is a glimpse of hope that maybe this will not get as high as it was in January. But the way things looking here in Palm Beach County, I don't feel very comfortable in even thinking that. So let me tell you why. We go to the next slide. You can see that our positivity, we were way down in the 2.9% at one point. At the beginning of June, we had been below 5 since May 5th. We were very happy, and we were actually had decreased from high, had gone down to moderate, and we were hoping to remain in that 2% and be able to go down to low. Unfortunately, that didn't happen. As you see here, towards the end of June, it began to rise just by a little bit, and then it rose very rapidly. We are now at 17.8%, way above the 10% that is critical, and definitely below the 5% where you can start having significant relaxation in terms of the virus and people getting sick and going to the hospital. So it's been very significant. And one of the ways that the CDC and we're looking at cases per 100,000 of the population, and we're at 616 per 100,000. So that gives you an idea in terms of the population where you're living as opposed to just the numbers. This graph to the right is very significant. This is our new cases per week. So back in our first increase that we had in July, our numbers went up to 17,000 in that month. But our cases per day only went up to 5,000. During the peak of the pandemic in January, our maximum number of cases per week was 6,000, so little under 1,000 per day. Look at this line now. We are at 9,000 per week. We have over 1,000 cases per day. That means that there's very, very wide community spread and that people are getting sick and people are being hospitalized. So this graph, to me, is more significant than just the number of cases that we are seeing. So I think this is very significant. I want you to remember this graph. The other graph that we also utilize in terms of our number of cases is a map that we utilize by Census Tracts so that the municipalities can look at their community. This is what it looked like on the week before that we sent, and you see that we had to add a new number that was that bright red. Now we've had to add another number because this little box here that was in the 76 to 90 is now 91 to 105, and this one out west of 441 and the Delray Boynton area has gone up to 106 to 125 cases per week. So you also see that the area out in Belle Glade has increased, and there's a lot of red and brown. If you remember, in my last meeting, I showed you the map in June that was really almost clear, very, very few spots. So very significant increases, and again, very rapidly, not giving the community and the institutions the ability to kind of catch up with what's going on. Here also is the Florida versus Palm Beach County. Florida's positivity rate is now 18.5, which is very high. The whole state is in red. I will show you that. But for the first time, Palm Beach County daily positivity has gone above that of Florida. And, oops, that doesn't help. You don't have magic vision to see what I'm seeing here, okay? So there you see that this is what I'm talking about for the first time that, does this thing not work for me? It just doesn't like the light blue. But anyway, you can see the two numbers, the 19.04 for Palm Beach County and the 18.50 for the state. This is the map of Florida, pretty self-evident, and you can see that the three numbers that we have are high, substantial, moderate, and then low. We had been in substantial ahead of Southeast, and we were the first county to turn yellow under moderate out of the 5 metros at the end of June. So big, big difference. Now we're all back to high at very significant numbers. This is all happening very much as a result of the Delta variant. A variant is nothing more than a mutation on a virus, which all viruses do. It is not uncommon. What has brought so much attention to this particular variant, one, that it's 60% more infectious, it's easier to catch, it produces more virus both in your nasal cavity as well as at the back of your throat where the virus first comes in, and therefore, because there's more virus within the nasal cavity and within the oral section, that when you breathe or shout or talk, it's much easier for that virus to go out and attack whoever is around them. The other significant part about this virus is that it's making more breakthrough cases. And what that means is that people who have been immunized, it is possible for them to then get reinfected with the virus. There's a lot of talk about booster shots. Right now, the boosters have been approved for those people who are severely immunized compromised in terms of people with organ transplant, cancer treatment patients, and people who are deemed very suppressed by their physicians. So that is available now, and that's been made available for people to get the booster shot. If you fall in that category, I would suggest that if you don't fall in that category, that you allow the vaccine for those who do fit in that category. But this is the significant part, and as you can see here, it's gone up to 93.3%. So it's been continuing to rise and to take over. The danger in terms of variant is that once this variant has taken control and is the predominant virus, will it then get to the point that it mutates sufficient that the vaccine will not work? At this point, the vaccine is working against all of the variants that we have in the United States. So that's a good thing, but we have to keep a close eye on this variant to see that something doesn't happen that makes it not resistant to the vaccine. In that case, a new vaccine has to be created to specifically deal with that particular variant. All these variants are still the coronavirus. So I don't want people misstating that we have a new virus. It's still the coronavirus, it's still a SARS virus, and that's important that everybody recognize that. This graph now has to do with our vaccination. And what you see here is that for Palm Beach County, we have 11% of the population over the age of 12 that has had one dose. That means those are people who either got only one dose and haven't come back for the second one, or that they just started the series and they only have the first dose. 58% of our population above the age of 12 have completed their 2 vaccines, so they have protection for the 2 vaccines. The total vaccinated, it's what the terminology that's used to add up the first and those who have completed. So we have 69% of our population, it has total vaccination. That 69%, I've said before, is a little bit misleading because that number includes all those people of 65 and older who have 80 and 90%. Okay, so that number, I think we need to keep our eye on the 58%, but again, the older folks, as you can see on this graph, have very high, up to 90%. The interesting part and the hopeful part is that these 2 lines, the 12 to 19, that's the high school age, and the 20 to 29, which are the ones that are very actively out. Well, some of these 19-year-olds are very actively out partying also, but these 3 groups have increased the number of their vaccination, but especially the 12 to 19. Those are the ones that are being brought in with their parents to get vaccinated. A lot of these are the school-aged children. So that's why I chose to look at this cut of 12 to 19 instead of the 12 to 14 that's usually described in the tables that we get. So this gives us an idea of these younger groups, and you can see that the yellow, the 40 to 49, is almost is above 60%, and the 50 to 59 is actually at 70%. So we're making strides. The only one that's flat, this is the 80 plus. I think most of them have gotten out and gotten the vaccine, and they're very flat. There's no more activity there going in terms of vaccinations. And then the other 2, the 60 to 69 and the 70 to 79, again, very high numbers here in the 90s. So we are vaccinating more people, that is good. The only problem is we're not vaccinating fast enough to deal with the virus that is spreading so quickly. So what are we doing in terms of vaccinations and testing? The Department of Health, and I'm not going to talk for the healthcare district because Darcy's here, so she'll take that on herself. But we have, we were the only health department, at least in Southeast Florida, that continued to do testing and vaccinations. In our Lake Worth Center down in Southwind, we have COVID testing for the public from 9 to 4 p.m. And we do all ages over the age of 2 can be tested. Our Florida Department of Health in Belle Glade, since day 1, we have been very active there, and we're doing both appointments. There's no appointments needed. They can come in and do COVID testing from 8 a.m. to 11, and they can have with or without symptoms. There's a lot of worried well testing that's taking up spots for people who are really sick and need to be testing. So we're encouraging those people that we see that are constantly coming in to move from the testing line to the vaccination line. And we've been able to do that with some education on some of these folks. Testing against COVID by using testing sites and being tested is pretty much like trying to do birth control with a pregnancy test. Okay? It doesn't make sense. If you want to be protected from the virus, testing you is not going to help you. because that test is only positive or negative at that one moment in time. By the time you walk out, you may have come in contact with a person the day before. And even though your test is saying positive, 3 or 4 days from now, you're going to be, even if it says negative, in 3 or 4 days, you're going to be positive again. So unless you test every single day, this is not the way to try to prevent the spread of the COVID. The way to do it is one and only way right now, and that's to get vaccinated. So, the new site that we have that has been very busy is a collaboration between the Florida Department of Health, the county, of course. Thank you very much for the use of your facility at Mid-County. It's been a great facility, very well organized there, lots of room. We're doing lots of testing with a vendor, CDR McGuire, that has come and is doing both the testing as well as the vaccinations. And again, we're trying to encourage those people to move from one line to the other. In terms of our mobile van, that's been very active also, doing both vaccinations, back to school vaccinations, as well as COVID vaccinations, and of course, testing. And we've gone out to businesses, we've gone out to different areas where we think there is movement, especially to some of the businesses that have a lot of the restaurant business in terms of workers. A restaurant can literally have to shut down, not because of lack of patrons, but because their staff all get sick. And one of the problems that we're having across the nation is that so many people are out sick. Bus drivers, truck deliveries, anything that you can name that requires human bodies to work. Many of the businesses are having to shut down because of so many people being out at the same time. So this creates a whole cascade effect where deliveries can't be given, or people can't get on transportation, things like that. So it's very serious across the whole country. The best site to find your vaccine, besides going to the county website, which is pbcgov.org, is to go to either the site for the Palm Beach County, which is pbchd.com, or the www.vaccines.gov. And in there, you can search within the radius of your home and look at the vaccines that you want, and look at the actual sites that have it in stock, and then you can go get vaccinated. In terms of testing sites, the site is hhs.gov. In addition to this site, this is a copy of that page, and as you can see, it gives you very good information. It gives you the address, when they're open, and of course, all of the government sites that we are running are at no cost. I would recommend anybody who is going to travel not to take their time at one of these sites, because most of the places that you're going to go to are going to tell you that the turnaround time now for labs could be anywhere between 5 to 7 days, because so many people are testing. So if you're going to travel and you want guarantee on your test result to be in your hands before you go to the airport, I would recommend that those folks go to one of the sites that's charging people for it and are able to then produce the test to them right there and then. We've had a lot of concerns, especially this weekend, over people actually showing up and the airlines refusing to allow them to change their sites because they had to wait for the result of the vaccine. So please don't ruin your vacations. Think ahead and make sure you get that test when you need it. In addition to all that, these sites are now new. These are being run by vendors. Again, South County Civic Center, Gardens Library, the Veterans Affair is also helping those who are veterans who need to be tested for COVID. With the help of all these sites, we have seen the lines not become extremely long, and I think this is helping a lot of folks across the county to be able to both get vaccinated and at the same time tested if they need it. So, additional efforts that we know are coming shortly. We've been working very closely with the county. Thank you for all the work that not only our leadership has done, but also the staff that's been working on this. Todd, Mary, Virginia, thank you very much. But we're going to see monoclonal therapy supported by an FDOH sponsored site that's going to do a drive-through, and we will be able to treat people for COVID before they get severely ill. This is one of the things that is really tying up the ERs, are people going to the ER to get tested. They shouldn't do that. They should get tested at our sites and allow the ERs to do what they do, which is to do emergency medicine in people who are critically ill. So please, we look forward for that, but if folks are listening, don't use the ER as a testing site. We're also, we have extensive provider education that's going to be needed to do this. That's being supported by the local medical societies to promote COVID monoclonal therapy for those that need it. We're also working on educational promotion at the testing sites to encourage the vaccinations as opposed to testing for, and encouraging to get treated with the monoclonal therapy instead of going to the hospitals and getting sick. We also have an aggressive local multimedia vaccination campaign that will be talked about very soon, and that is very important. We have some national advertising that's taken place, but I think we need a lot more, and I'm very excited about the campaign that's been put together that we will soon see. So, in very short summary, we have the Delta. It's very highly transmissible. Hospitalizations at our critical mass capacity right now, and data from recent weeks show that the unvaccinated children and younger adults are now account for more than 98% of the COVID hospitalizations. So very important, you do not have to be one of these people in the hospital. Please get vaccinated for you, your family, and for the whole community, and for the whole medical system that's being stressed out to the max at this point. We need more people to get vaccinated. Thank you.
Thank you, Dr. Alonso. We'll go now to our emergency manager, Mary Blakeney.
Good morning, Mayor, Vice Mayor, Commissioners. It's good to see you all up there well today. I'm just going to briefly go through the remaining indicators that we are still able to collect through our CPR matrix. And we'll go ahead and start with the positivity, as Dr. Alonso said earlier. The upper right graph shows the overall positivity rate, which has been increasing for the last 6 weeks. We're currently at 7.80%. At this time last year, our overall positivity rate was 13.23%. The lower left-hand graph indicates the positivity rate over the last 10 weeks of testing. As you can see, it's trending upward. The next one goes to our daily lab positivity. The graph on the upper right shows the daily lab positivity rate since last July. The lower left-hand graph shows our daily lab positivity rate this week averaging 17.8%, which is above the target we look for of 5%. The daily lab positivity rate has been above 5% since July 13th. As it relates to COVID-19 deaths, the graph on the upper right-hand corner shows that our COVID-19 related deaths have remained stable. Our current death rate is 2.17%. The next is our daily med alerts. As you know, Palm Beach County Fire Rescue does a countywide sample of people with COVID-like illnesses who have symptoms that call 911. Those are put in as med alerts. We can see by the chart in the lower left-hand corner that med alerts have increased. This past week, the average was more than 33 patients a day. Those are the highest numbers since the onset of COVID. And just to also emphasize on the vaccination sites, we continue to encourage our residents to get vaccinated. Working with our public affairs department, we provide an updated list constantly of resources that are on our county websites that individuals can go to for vaccinations. And as Dr. Alonso said, in addition to encouraging residents to get vaccinated, with the increase in testing demands, over the past 2 weeks, testing resources have been made available through the 3 new testing locations at Mid-County Senior Center, South County Civic Center, and the Gardens Branch Library. It's important to note that these sites are open 7 days a week from 9 a.m. to 7 p.m. We anticipate additional sites to potentially come online, and I think Darcy Davis may touch a little bit on that for us in just a moment. But along with our testing numbers increasing, we've also seen an increase of individuals getting vaccinated over the past 4 weeks. We have vaccinated over 888,000 people in Palm Beach County, which represents 69% of our 12 years and older population. We continue to encourage people to get vaccinated while wearing their masks, washing their hands, and watching their distance.